Welcome to Inside Cape Cod, the weekly public affairs program for the Cod-Comm Radio Group. Join me as we delve every Sunday morning into the important issues here on this wonderful place we call home.
Good morning, Cape Cod. You are listening to Inside Cape Cod. My name is Missy Jones. Today I am joined by State Senator Julian Cyr, who is the senator for Cape Cod and the Islands. Julian, thank you so much for joining me this morning.
Missy, thank you for having me. Good morning.
Good morning. So we're gonna get right into it because he just told me that they have a big Zoom meeting happening almost as soon as we're done interviewing. So I'm gonna jump right into questions. Firstly, we've heard a lot of Governor Baker talk about preparing for the surge of COVID-19. What exactly does that mean?
So this is, first of all, a tremendously difficult and unprecedented time for people who make a life on Cape Cod, Martha's Vineyard, and Nantucket. It is for all Americans. And so we're working really hard to provide all sorts of help and resources and information that we can get out to our constituents and the people who make a life here. When we talk about the surge, what we're talking about is the epidemiological influx of people who not only are going to have symptoms of COVID-19, but are going to and are already having pretty significant symptoms where they need to be hospitalized. So not just a shortness of breath, but a real inability to breathe. If you look at how COVID-19 impacts the lungs, it essentially basically turns your lungs almost into like this marshmallowy substance that it becomes very difficult to breathe, and that's when people are advised to be hospitalized. So the surge is the projection of cases of individuals who are going to need and require hospitalization. Now, under normal circumstances, our health system is not prepared to take such an influx in patients needing this level of care. What we have been doing across the state, and we've been doing specifically on Cape Cod and on both islands, is preparing for the expected epidemiological surge of patients that we're going to be seeing. So when we talk about surge, we mean a near doubling of hospital beds at Cape Cod Hospital. It means a real increase in the number of ventilators that we have access to, that we have on site. And it means really preparing for an influx of patients that, really may very well overwhelm our hospitals and healthcare providers. And so that's what we've been working really, really, really hard to prepare for. It also means finding locations where people can, people who have serious COVID symptoms but may not require hospitalization, but do need some level of care. Cape Cod Healthcare has actually identified 2 nursing homes that they've converted. They're converting to what are called COVID step-down beds, so places where people can recover. There's 300 beds there. Similar efforts are underway on Nantucket and Martha's Vineyard. Of course, those hospitals are much smaller. So Nantucket has a 15-bed hospital. Martha's Vineyard has a 24-bed hospital. They have upped their capacity. And also we've been working with them to look at how do we get truly acute patients who need significant significant health care. We all need mental health care too, but acute health care off island. So that's what we mean when we're talking about surge. And I think we're expecting to see the surge happen in Massachusetts between April 10th and April 20th. It is sort of the 2 weeks in which we're expecting to see this if the data we have on cases is accurate.
So how do you guys come to that determination, that it's going to happen between the 10th and the 20th? What data are we using?
So folks a lot smarter than me are doing this work. These are state epidemiologists, and we have a whole phenomenal Department of Public Health who has experts who really study all sorts of diseases, but particularly in this moment, look at COVID-19 And if your listeners just go to almost any news site, right, we're tracking the viruses, and you basically see this trend, right, where there's this sort of steep incline in the number of cases, or a steep incline as well in the number of deaths, as we're seeing, so sort of exponentially, right, every 2 or 3 days, a doubling of cases. That's indicating that we're going into a surge. And so first, you're going to see, for the first indicators, you're going to see more positive COVID tests and more individuals who are diagnosed with COVID, and then you're going to see more individuals, as the disease is progressing, more individuals who need acute medical care and need to be hospitalized. And so that's what we talk about when we talk about the surge.
Okay, yeah. So we've heard a lot from, or not, maybe not from, but about federal Congress and, of course, from the governor. Walk me through some of the conversations that are happening on the state level. Like, what are you guys most concerned about, and what's being done?
So we are concerned about sort of a myriad of issues and challenges, everything from, first and foremost, supporting our hospitals and healthcare workers, to meeting an unprecedented demand for unemployment. I've been doing a lot of work around the needs of older adults and folks who are either in nursing homes or receive home health care, but a myriad of challenges. So from the administration side, the governor and his team have established a command center that is managing and sort of overseeing this work that we work closely with. On the legislative side, we've been working very hard, albeit mostly remotely, to basically do three things. As legislators, we are appropriators, right? So we appropriate money. We come up with resources to help fight the pandemic. We're problem solvers. So, whether it's issues around, I was talking about helping to get patients planning to help to get patients who may need to get off island, Nantucket and Martha's Vineyard, making plans and coordinating with the Steamship Authority, with the Coast Guard, with other assets, with Boston MedFlight, to addressing the needs of homeless people here on Cape Cod, trying to solve those problems. And then we're also communicators, and we're a place where people can get, accurate, reliable information. If you go to senatorcyr.com, which is senator and then CYR is how you spell my last name. So senatorcyr.com, we have about 30 plus pages of information, resources, questions that if you've got a question, we probably have an answer for it. And if we don't have an answer for it or have some information for you, we'll find that out. So that's what we've been doing. On the Senate side, the Senate President Karen Spilka established a working group in early March to work on the pandemic. And I was appointed to be a member of that 8-member group. So we meet every morning at 8:30 a.m. on a conference call, and we identify issues. We raise them up the flagpole, and then we work to prioritize legislation. We've already passed a number of bills, including 2 bills to help unemployment and expand unemployment benefits, legislation that's been signed into law that provides clarity to municipalities and help to municipalities around how do they conduct their business in a pandemic, providing for takeout of beer and wine, which is something that we've heard a lot from restaurateurs who are trying to stay open, trying to make it via takeout. We're going to be taking up legislation on putting a moratorium on evictions and foreclosures to help people who can't make the rent or can't pay the mortgage. You shouldn't be kicked out of your home because of this crisis, and legislation as well to postpone MCAS. So we're doing a lot legislatively. We have moved almost all of that work to remote work. So it's a lot of conference calls, so that we're making sure that we're keeping our staff safe and we're keeping our colleagues safe. But the essential work of government continues, and we're keeping at it, basically at a daily basis, or on a daily basis, I should say.
That is amazing. I can't even imagine being on phone calls all day. That would drive me nutty.
People ask me how I'm doing, and I say, it's like, well, I'm in conference call and extrovert hell, but I certainly am very fortunate, and don't have much to complain about now. Particularly given what so many other folks are doing. I think it's just remarkable how, in this moment, right, we're so dependent on our healthcare workers and our first responders, but also the people who work at the grocery store and the people who are keeping gas stations open and who are doing deliveries to people who can't get out of their house. And I think it's just, those are the people who are really have stepped up and are just doing heroic work. And that's more than admirable. It's admirable. It's essential.
Right. So just mostly, of course, out of curiosity, right? How are the votes happening if everyone's remote?
Yep. Sure. So we do our work. Through what are called informal sessions. This is actually a mechanism we use, during our regular business. We typically use it to move routine legislation, right? Say a town needs legislation to do a land transfer or some sort of need. So we're using that informal session process where only one or two members actually come into the chamber to conduct the business, and we're essentially conducting our business through unanimous consent. So everyone has to agree to what we're doing, which, in a deliberative body can be a really big challenge. But we're using this mechanism to conduct our work so that we're adhering to social distancing, but also making sure that the mechanisms of the state legislature continue. We've actually passed a pretty significant chunk of legislation through this process, which is, it takes a lot of work, it takes a lot of discussion, but I think is really important. We as if you're someone who's in public life, the inherent part of your job is to come into contact with a lot of people. And so I think we also, as legislators and as elected officials, need to be honest about, the potential risk we could pose if we were just conducting business as usual, given the amount of people we come into contact with on a daily basis. And so it's really important that we're adhering to the social distancing and, the stay-at-home orders as much as everyone else.
So let's talk masks, because I know I've been seeing a lot of mixed articles that, you don't need a mask if you have to go. Now, of course, for everyone, this is if you have to go outside, go to the grocery store, gas station, pharmacy, stuff like that. But you don't need a mask if you have to go out versus you need to have something covering your face, whether it be a bandana, a t-shirt, etc. What should we be doing?
Yes. This is a great question. So the guidance from the CDC, which the state of Massachusetts has also, affirmed, right, is that people, when you go out in public, people need to be wearing a mask or a mask-like covering. We want to, of course, prioritize actually medically grade N95 masks for healthcare workers and for first responders. We don't want to. We're already really, one of the biggest challenges we faced has been securing what's called personal protective equipment for healthcare workers, for first responders, for other people who are doing essential work. So we don't want to be limiting that supply. There's already a limited supply of that. We don't want to be furthering that. So encouraging people to make a mask at home. I have a wonderful aunt. I have a big, large extended family, and she actually made masks for everyone in our extended family and mailed them to us, which is some 70 odd people. If you don't have an aunt, an aunt who's doing this stuff, or an uncle who's doing this stuff for you, there's some actually very simple ways that you can make a pretty effective mask with an old T-shirt and 2 rubber bands. But what you want to make sure that you're doing is having some sort of covering over your mouth and your nose. This is actually, yes, to protect you, but also more importantly to protect other people. We know with COVID-19 that a large number of people who are infected with COVID-19 are asymptomatic, meaning they don't have symptoms, they don't know that they're carrying the virus, and they don't know that they potentially could be spreading the virus. And so, the guidance is, and I've been doing this, and most everyone I know is doing this, is when you go into a space, a place where you're with other people, where you have to conduct essential business, whether it's the grocery store, the pharmacy, or a bank, right? You need to have a mask or a mask-like covering, and you want to fashion something, a DIY, if you will, a do-it-yourself mask. You can do that and encourage folks to check it out. If you Google it, there's a whole array of options that you can use using cloth that you have in your home.
We're going to switch gears just a little bit for a second. Let's talk tourism. of course, the Cape and the Islands do run mainly on the tourist economy, but other states haven't really they didn't start their stay-at-home advisories until either the same time or after us. And so it's almost a double-edged sword, right? We, as the Cape and Islands, we need a lot of the money that the tourists are going to spend, but if there are still active cases of COVID-19, then that could run the risk of either making our outbreak worse or, hopefully, if it's over by Memorial Day, starting a second one. As, not only as our state senator, but also as a resident of the Cape, what do you think the tourist season's going to look like?
So I don't think we know what this is going to look like. Not only one, because we don't know when we're going to be able to come out of this public health emergency, and even when we do, what precautions are going to need to be continued to take in place, but also because we're likely entering a pretty significant recession because of this, right? And so, the economy is going to be really struggling in itself, right? And when that's happening, we do tend to see less visitors. So I think we don't know. I'm acutely aware of the situation, and I understand, look, as someone who grew up in my family's seasonal restaurant that my family had for 30 years, I understand so well what having a muted or even a non-existent season is going to mean for so many people on Cape Cod and the islands. We make the bulk of our livelihood in hospitality and welcoming people here. And so we're just going to have to take that one day at a time. Currently, there's a number of provisions in place that are meant to help tourist communities or seasonal communities like ours. Under an executive order the governor filed, I think last week, all leisure accommodations are not allowed. So hotels or motels or Airbnbs or rentals can lease or rent to essential employees, essential workers like healthcare workers or first responders, but leisure accommodations are not allowed. I expect that continues under the executive order through May 4th. I expect it may be extended, so that may be, as long as we have that, that's going to affect who's able to come here, and that really, I think, also helps protect our communities. But this is a huge, huge challenge for us. And even if we do open back up, a lot of our seasonal businesses rely on workers who come here in the summer, foreign workers like H-2B and J-1 visa holders.
I forgot about the J-1 kids.
It's really unclear if they're even going to be able to get here and come here. So there's a number of situations that we could have. We could have, the best case scenario, I think we need to plan for and expect that we'll have a muted summer, but we may really struggle to find workforce. It's going to be a huge hardship if, for a lot of folks, like my family who would make their living, the bulk of their living, right, in those 8 or 12 sort of precious weeks in the height of the season. Most of the employees and small business owners I talk to who are in the tourism industry or in hospitality essentially say, they can kind of make it through until we get to July 4th. But sort of after, if we're still in this predicament, well into July and August, we're going to need, our communities are going to need a serious level of help because, if you have a lost summer, you don't have an opportunity really to make that good money again for a whole other year. And that is just going to be a tremendous challenge for us. So there's a lot of unknowns. We're taking it one day at a time. We're trying to be as prepared as we can. And, it's already a challenge, and it's going to become a much more acute challenge as the weather gets warmer and nicer. And as, this is a time of year where people are just kind of, the tourism economy is just beginning to wake up. But the longer this persists, it is a huge hit for Cape Codders and Islanders who make their living on welcoming people from all across the world. So we're aware of it, but it's a big, big, big challenge.
Yeah, totally. So let's say in a, God forbid, worst case scenario that this is still persisting through Memorial Day and maybe even a little longer. What Do we know what would happen if people like came anyways? Like that'd be a problem, right?
So we've already seen actually a slight population influx. This has been a real concern, particularly on the islands, which have, I mentioned earlier, Nantucket has a 15-bed hospital. Martha's Vineyard has a 24-bed hospital. They are staffed to meet the needs of their year-round population. In the summertime, they bring in additional staff to help, to help sort of serve the much larger population they have. They don't have that staff now. So we've already seen a bit of a population influx of folks coming to sort of ride. I get why people want to come here to ride it out. What I've been saying is, look, we have very limited healthcare resources, particularly on the islands and on the Outer Cape. You come to my neck of the woods where I live, we're an hour from the hospital, right, on a good day. Mm-hmm. So that people really need to know that we have limited resources. They should really think twice. They probably shouldn't come, and they should think twice about coming. And if they do come, they need to adhere to a strict 14-day quarantine where they get all their provisions and supplies for that quarantine, groceries and whatever, sort of off Cape before they come, and then to abide by a strict 14-day quarantine. And I understand why people want to come here, and I think more people are going to want to come to their second homes or their family homes, as the weather gets nicer. And I think we just really need to communicate that people need to practice very good, strict social distancing and self-quarantine if they do come, but reminding people of how limited and fragile our resources are, particularly this time of year when we, in July and August, we are staffed up and prepared to serve a much larger population. That's not the case in March and in April.
Right. Okay, so how I end all of my interviews is I like to flip the switch and ask you if you think there's anything I missed asking, or if there's anything that you'd like to add, people you'd like to thank, anything like that.
So first, I want to just reiterate that we have a whole wealth of resources and information on senatorcyr.com. That's senatorcyr.com. And if you are someone who's got a question, you're having difficulty filing an unemployment claim, you're a small business that needs help applying for some of the loans and grant programs that have been put out there, please don't hesitate to reach out to me and to my office. You can email me directly at julian.cyr@masenate.gov. That's julian.cyr@masenate.gov. And we're glad to do everything we can to help. Missy, this is just a tremendously difficult time. I'm in awe of, the people I hear about every day, who are running our hospitals, who are, caring for some of the most vulnerable people, who are working in our grocery stores and keeping pharmacies open. And that, that takes a lot of courage, and I'm just sort of I'm in awe of that and grateful for it. I also think we've got a really strong community here on Cape Cod and on Martha's Vineyard and Nantucket. We're blessed to live in a beautiful place, where, you can get out and go for a walk, typically, and comply with social distancing, which I think is a real gift that we have. And we're also a place that, we know that we're in it together out here at Land's End. And so, that's a real strength that we have. But, really just urging people to take good care. If they need anything, don't hesitate to reach out. We're going to come through this, but there's a number of really hard days to come, and I think we're going to be seeing those hard days over the next several weeks as we see the surge happen. And so just wishing people all the best, and really, asking folks don't be shy about reaching out to help, reaching out for help. That's what we're here for, and we'll do everything we can to do our part. And so just thank you for inviting me on, and making this all happen too remotely from home is probably a whole feat. So I don't know how you do it, but
I texted my mom. I live with my parents, and my room is directly below the living room, and I said, "Mom, don't move." for 30 minutes.
Yeah, my roommate and I will do that. We'll be like, I've got to go to this interview. I've got this conference call. Don't
make any
don't
noise.
make any loud noise.
Julian, thank you so much. Thank you so much for coming on.
You're so welcome.
And
of course.
If anyone out there has an organization or cause that they want featured on the show, you are more than welcome to email us at insidecapecodradio.com. Stay safe out there, Cape Cod.
Inside Cape Cod is the weekly public affairs program for the Cod-Comm Radio Group. Tune in next Sunday at 6 a.m. for more Inside Cape Cod.